So this is also being broadcast globally on your YouTube. Audience auditorium after we finish this week. If you can want to get the.
So on behalf of my honorable colleagues represented here and the companies who had donated, and on behalf of the Department of Health and Family Welfare, invoking God's blessing, I do this honor to inaugurate the 10-bed ICU. I hope you could come to a great help to the citizens of Dhaka. So, God bless.
The ICU project in district hospitals and tele-ICU hub at NHAA by Sri Nepiu Rio, the Honorable Chief Minister of Nagaland, on January 6, 2023, in the presence of Sri Pang Yu Hom, the Honorable Minister of Health, donated North Kotla, Menlo Park, California, USA, and HDFC Bank, Parivarta. Thank you so much, sir. Thank you for the invitation.
Thank you.
Sir, we will not go inside. We will just show you from outside, but perhaps you can. Sir, please. Yes, I'm. So both the 10-bed ICU ward as well as the tele-ICU hub is what you are inaugurating. It's connected to all those 12 hospitals across the entire state. Sir, you can do the honors and just a second, sir. We'll just have the health minister also there. Please. Please come. Thank you so much. Please. The equipment, we have just placed a few equipment for you to see. These are all state-of-the-art, not L1 equipment. We've imported ventilators from Switzerland, ABG auto analyzer from Germany, Siemens. So the blood analysis, instead of sending it to a lab, you can put a drop of blood on this chip, put it in there, and it gives you a blood analysis. So this is the equipment from Germany, Siemens. Here is an ECG machine, small portable machine. Here is a portable X-ray that you can take to the ICU ward. You don't have to move the patient to a lab. It can be done. So we'll show you first the 10-bed ICU ward, then we'll show you the tele-ICU room. So this, sir, here it is actually split up into different wards. We'll just show you from right here. We don't have to come inside. Yes, we have already patient. That is the ventilator from Switzerland, the Hamilton Medical, very advanced AI ventilator, so that in rural, smaller areas, even if you don't have a specialist, the AI can do auto weaning. It will stop the ventilator by itself, knowing the pressure of the lungs and the CO2 level. So this is why we imported that equipment. The 5-para monitor, all of this equipment, we have created a LAN, networking, computer networking. They're all connected to the cloud. Because these hospitals in far-off areas need to be connected to the hub here in the other room. So I'll show you. This is like Clark and other facilities where these kind of ICUs are. Exactly. So here you see a camera. There are about 3 to 4 cameras in each of the district hospitals we have kept. And we'll show you how the cameras are used in the hub. Okay. So this is an example of a 10-bed ICU. Of course, here it is split up into many rooms. Yes. So this is the tele-ICU hub. This is, of course, donated by Mr. Vinod Khosla, the VC from Khosla Ventures. Yes, absolutely. You'll be interacting with him today. So, sir, this is the tele-ICU hub in Nagaland, where what is happening is, at NHAK KOHIMA, we have connected all your hospitals, all the district hospitals, over high-speed internet. 6 of them are on high-speed internet. 6 more, we need your help to get high-speed internet for the hospitals. Wonderful, wonderful. So we will show you what functionality is available. Can we switch over to the software? So this is running a software called CARE. United Nations, we have won an award for this. It's in open source for everybody to use. This hub is connected to all these hospitals live. This is all live right now. So what we're going to do is we're going to show you how this connectivity helps, how the specialists sitting here at NHAK can help the patients in the district hospitals. For instance, here we will have the hospitals of the, yeah, it's just coming up. So this is NHAK itself right here. We are showing. Chunsang will appear now shortly out here. Zuneboto is will show up there. You see that? Those are all live. The camera that you saw there, that is broadcasting in a high-res mode. The high-res camera is so accurate that you can see the pupil of the patient sitting here, hundreds of kilometers or so. Very, very accurate. So you're also, you can see Zuneboto out there. And there you see Dimapur connected, live. And this is Chunsang. Absolutely, absolutely. This Chunsang is showing up. So this is live, as you can see. By the way, your constituency, Naklak, is also here on the laptop. This is also live.
Mobile, they are quite fast. Yeah, yesterday. Yeah.
Yes. So, sir, what we will do now is we will actually do a demonstration for you. Dr. Akre is here as the specialist, and he's going to connect with one of the hospitals, and he will try to help a patient online just in front of him. We thought we'll show you the demonstration. Yeah. This is from our group. Sai, go ahead, get started.
Yeah, my name is Silis Min, and I'm the hub coordinator of this NHAK. So I'll do some demonstration. तो मैम सजेस्ट करने ना मुझे नगम मिस्टेक करो वाला कल्चर क्या कर लेना मुझे अच्छा तो इधर मैं दिखा दो इधर केयर सॉफ्टवेयर है ना केयर सॉफ्टवेयर इधर इस स्क्रीन दो फैसिलिटी स्क्रीन कर देना फैसिलिटी ये ते हॉस्पिटल की मानता NHAK के कनेक्ट करना है दिखो रे ना इधर थोड़ा डिस्ट्रिक्ट कनेक्ट करना है अरो इधर मैं डॉक्टर अक्रे अरो जिनसंग ना डॉक्टर के कनेक्ट करना एक ता पेशेंट ना कंसल्टेशन कर ट्राई करो ना तो
here we are trying to connect to Dr. Allenbach in Jinsang Hospital.
One of the patients.
One second, one. Okay. They have patient details of by the way, symptoms, history of pregnant illness. By yet Tagina, Koimara Tagina, Jinsang La Takla information part, no money, Marina, Camera cases of by the और कैमरा फिट थे अलग अलग प्रीसेट चाहिए अपनी जना zoom mana face tahu gulu inya control ko और mo ito control ta baro
Automatically zoom in.
ya tai jatare jaina uto camera ge adjust kuru inya na mona camera ta ge focus kuru na niya monitor samung jaro monitoring ta bai ko na aram ita mon doctor consultation mona dikhai
Yeah.
diba na
Yeah, but just one this thing, even though you can see it on the camera, we are also getting the actual waveforms on the cloud. That can also be seen right here on the software as well. Live data. Yeah.
Dr. Alan Bach, medicine doctor, he's in Yunsan right now. He's live. Dr. Alan Bach, can you hear me? Okay. So can you share a little bit about Yunsan ICU, about the patient that you have in Yunsan?
We have a 50-year-old patient, a non-case of cardiomyopathy with mitral stenosis. He was admitted with difficulty in breathing.
Right.
And when he was admitted, his oxygen saturation was very low.
Right.
So after admission, in the 3 days period of time, his condition is improving.
Okay. So earlier his condition, he was on oxygen. Right now he's gradually improving in the ICU. So now he is off the oxygen, he's able to move around. So he's much better now.
Wonderful. Wonderful.
Thank
Sir,
you.
we need your support. Sir, we need your support to ensure that the doctors are assigned to help all the district hospitals here at NHK. Specialists need to be assigned because there are so many hospitals that are being added. 12 hospitals are being added to their load. So we need more specialists to help them. Right. Sir, similarly, you can see at the various locations, we can do the same. We have set up 3 stations. 3 doctors can simultaneously talk to different hospitals and help them. If there is a need for more, we can always add in the tele-ICU hub. This is all cloud-based software, sir. This is high-speed internet that is connected to all the district hospitals across India.
Very good. So these are the latest.
So this is the latest system that we have built. I was in California about a month ago. I demonstrated this system, the care system with tele-ICU in California. And in fact, one of the intensivists, pediatric intensivists said, we don't have systems like this. We have similar problems with rural areas. We are using mobile phones to talk to doctors. It would be lovely if you can provide something like this. So this is the latest system we have built for the tele-ICU project. We built it. Yeah, absolutely.
So the health workers, doctors who are in the remotest places, they'll have more confidence to attend to the opinion.
Exactly.
Yeah.
Absolutely. So just just the other day, one of the doctors at 12 in the night from home, he used our software on the mobile phone, helped to get intubation done through nurses and saved the life of a 53-year-old woman, which was not possible because it's far away in the hills. You cannot move those patients. Whereas with this system, Dr. Akhre and others can actually connect and even go home and work on their mobile phone and save lives. So that is the power of this tele-ICU module.
Okay, very good.
Thank you. Thank you.
Thank you all the best.
Thank you, sir.
Sorry. You have done marvelous.
Oh, thank you so much. Thank you. Yeah, the only thing, like I said, we need that specialist to be deployed.
about the 10-bedded ICU project at my state Nagaland. The project has the potential to bring
Here is an announcement.
change and healthcare delivery across Nagaland. Nagaland is a topographically challenging location. So, the Delhi ICU infrastructure coupled with the ICU
Hello.
units
Right. Ladies and gentlemen, here is an announcement. The owner and driver of the following vehicles may kindly repark your vehicles. NL01H0692 Ritz, NL01H0692 Ritz, NL01P6575 Creta, NL01H5196 Maruti Suzuki, NL01P2972 Duster. The drivers and owners of the following of the mentioned vehicles may kindly repark your vehicles. Thank you.
that have been set up under the project. Our people,
May I request
and the
the
remote
audience
districts,
to kindly maintain social distancing as you sit on the
for
hall.
example,
Kindly
our
maintain
patients
social
and
distancing
districts
on alternate
as
chairs.
Moklak,
Thank you.
Jeffrey, Mon,
This another
and
announcement.
others
Our Honorable Chief
suffer
Minister and
immensely
his entourage
due to the
has
lack
already
of
left
medical
NHAK.
care facilities and
So,
specialized.
as our Honorable Chief Minister
Upon time,
and his team
leading to
arrives
the loss
at the
of
Capital
precious
Cultural
life
Hall,
on the way to the
may I request
higher order
the audience
facilities and the state
to be
capital
prepared
or
to stand up and
near
greet them.
city. Now, the Delhi ICU facilities would enable the doctors and district hospitals which lack specialized medical practitioners to get real-time medical advice and consultation from specialized and Naga Hospital Authority, KOHIMA. The project is a win-win for all. Since Nagaland has universal health insurance coverage, with the new ICU infrastructure and technology, the people can get their treatment done for free using the insurance coverage in their home districts. The hospital can generate more revenue, reinvesting and upgrading the hospitals. We need to capitalize and amplify. Health is a merit good. Hence, it is the best left to the public system. I'm grateful that intelligent and well-meaning people like Mr. Vinod Khosla and Mr. Serikan Nathamuni are the people who made this project a reality. Heartfelt thanks to Mr. Khosla for his generous support to set up ICU wards in 11 districts and Delhi ICU across 12 districts in my state. You will get blessings from the thousands of families in Nagaland. Please continue doing great work. We need people like you to work towards the development of Nagaland collectively. I would like to avail my staff and the health department, doctors and NHAK and the district hospitals to collectively work and make the project implementation a grand success. As John Rawls, the Nobel Prize-winning economist, says, using the well of ignorance, work as if we will not know whether we will be born in a rich family or a poor family, or whether we will be treated in public hospital or private hospital. Our people deserve the best. Let this be the beginning towards a big change. I would like to extend our gratitude to e-government's foundation and appeal to them to continue doing more projects for the greater good.
A gentle reminder to everyone, kindly keep your mobile phones on silent mode and refrain from littering the hall.
Excuse me. You can come forward.
Shall we all rise up to welcome our Honorable Chief Minister and his entourage? Please be seated. Greetings and a warm welcome to all dignitaries from donor agencies, legislatures, officials from various departments, representatives from churches and civil society organizations who have come for attending this program. We would like to felicitate our guests for today's function, and as I call out your names, may I request the dignitaries to come up on this dais. I would like to request Sri Pangyu Pom, Honorable Minister, Health and Family Welfare, our Chief Host, to do the honor of felicitating our Honorable Chief Minister, Sri Nipurio, who is the special guest for today's program. Sir, please. Thank you, sir. Please be seated.
Chairman of 10-bed ICU project, founder and chief technical officer of Aadhaar, a technocrat who spent 15 years in Silicon Valley, California, working on CPU chip design and internet startups, co-founder of the e-Governments Foundation, board member at HDFC Bank, chairman of NovoPay, a Bangalore-based fintech. Ladies and gentlemen, please welcome Sri Srikant Nandhamuni. I would like to request the Honorable Chief Minister, Sri Nipurio, to do the honors and felicitate Sri Srikant Nandhamuni. Thank you, sir.
May I request Sri Y. Kikitosema, IAS, Secretary Commissioner of Health and Family Welfare, Government of Nagaland, to kindly felicitate Sri Pangyu Pom, Honorable Minister, Health and Family Welfare. Thank you. Please be seated.
I request Dr. Tamjang Sangla, Principal Director of Health and Family Welfare, to felicitate Ms. Bisoya Loitongbam, Policy Lead and Program Coordinator of e-Government Foundation. May I also welcome on the dais Sushanta Kumar Panigrahi, Senior Vice President of HDFC Bank and a donor. Sisir Kumar Bora, Vice President of HDFC Bank, also a donor. Vikant Narayana Chekuri, Secretary of Karuna Trust and a partner, and Dr. Autushi, Managing Trustee and a partner of Gandhi Ashram.
The following delegates, donors, and vendors are kindly requested to stand wherever you are as the ushers felicitate you. Sushanta Kumar Panigrahi, kindly, sir, please stand up wherever you are. Sushanta Kumar Panigrahi, Sisir Kumar Bora, Dr. Rakesh Nothongbam, Ole Bora, Dr. Shubhanshu Patacharya, Mukta Gohan, Divapratim Baroa, and Rajesh Sethi. Thank you so much.
To invoke God's presence, may I request Reverend Vezopa Rako, the President of KOHIMA Baptist Pastors Fellowship, to lead us in prayer.
Let us all look to God in prayer. God, our Heavenly Father, we thank you for this beautiful time you have given us. We are gathered here with our hearts full of thanksgiving and praise for all your goodness and the benefits that we receive each day from you. We are here today to honor and celebrate another wonderful blessings you have brought into our city, into our land, into our state. The new health facilities, the ICU, 10-bed ICU project in KOHIMA, NHK. We give you all glory and thanks to you, Lord, that now, with your blessing, many people would be saved and many sick people who are in need of good health may be healed through this project. Father, I thank you for all those who took initiative in this project. The government of Nagaland, led by our Chief Minister, Nipurio, and the Minister of Health and Family Welfare, Espang Yupom, and the medical department, authorities, and all the NGOs, the e-government foundations who have donated and help this come true. Lord, I pray that you bless them and use them even in a greater ways, Lord, in the days to come. Now, as we begin our program, we invoke the presence of the Holy Spirit to guide us and lead us and make this program enriching and meaningful for all of us who have come to witness your wonderful blessing again, Lord. May you take the lead and bless all of us, all the participants, that even in this program, we will learn to appreciate you and thank you, Lord Jesus. Committing the rest of the program to you, now I pray in the name of my Lord and Savior Jesus Christ. Bless all of us together. Amen.
Thank you, Reverend. May I now request Sri Y. Keketosema, IAS, Commissioner and Secretary of Health and Family Welfare, Government of Nagaland, to please give the welcome address.
This is the day that the Lord has made, and we will rejoice and be glad in it. As the saying goes, coming together is beginning, keeping together is a progress, working together is a success. The launch of the 10-bedded ICU project is a testimony to this. On this historical day of the launch of 10-bedded ICU ward across district hospitals in our state and a high-tech telehub at Naga Hospital Authority, I warmly welcome our most respected special guest, Sri Nifi Rio, the Honorable Chief Minister of Nagaland, our Chief Host, Sri S. Pangyu Pom, the Honorable Minister for Health and Family Welfare, Reverend Vezopa Rako, the President, KOHIMA Baptist Pastors Fellowship. With warm delight, I welcome our respected guest of honor, Sri Vinod, a successful technocrat, a philanthropist, joining us online from California, and Sri Nanandan, the founder and the CEO of ADA, the chairman of Infosys, joining us online from Bangalore. I am also thrilled at the presence of our most respected guest, Sri Srikant, the founder, the chief technical officer of ADA, and the chairman and the brain behind 10-bedded ICU project, who has been with us for a couple of days for guiding and helping us. Our partner, the team from eGov Foundation, who coordinated the project, including fundraising and the technology, who have been working with our officers and staff 24/7 to make it success under the dynamic leadership of Mrs. Bishwaya, Policy Lead and Program Coordinator, eGov Foundation. Mr. Susunta, Senior Vice President, Mr. Sisir Bura, the Vice President from HFDC Bank, who is also a donor to this project. Mr. Vivant and Mr. Awatoshi, heads of NGO partners, Corona Trust, and Nagaland Kandi Ashram, and other dignitaries, media fraternities, and ladies and gentlemen. I extend warm welcome to all of you who have joined us at this launch of the much-awaited launch of this 10-bedded ICU project. COVID pandemic was like a blessing in disguise for our people. And as one of the COVID warriors, both in the first and second wave, and particularly in the second wave, I have seen and witnessed how people struggle in search of ICU bed and oxygen. And to fulfill the burning desire of our people, this solicitous gesture was introduced in the bright minds of Mr. Vinod and Mr. Sirkan and others who have come forward in providing much needed machineries and equipments to our people. As I have shared with Mr. Sirkan a couple of days back, may this be the beginning of our partnership, and as we like each other, we would like to marry you permanently for a win-win situation for the benefit of our people. Henceforth, the serious patient from the far-flung district of Mon, Tongsang, Longlin, Kipiri, Samothur, Noklak, Zinaboto, Pak, and so on and so forth need not rush to KOHIMA and Dimapur in search of ICU and oxygen. The telehub at Naga Hospital Authority KOHIMA and the experienced and the most professional doctor will guide the health workers in the district as and when required. The department shall monitor the particulars of the patient, the condition of the patient on a real time. A time may come when our own children studying in Bangalore, in Delhi, may approach the hub so that they can able to see or interface with their own parents or relatives from the place where they are studying. Ladies and gentlemen, the rest of the program will be interesting and amazing. Thank you.
Thank you, sir.
Introduction of 10-bed ICU project, launching of 10-bed ICU video, and also to give a highlight of the donors. This will be taken up by Shri Srikant Nanthamuni. May I welcome the chairman of 10-bed ICU project. Sir, please.
Well, Sri Nephew Rio, the Honorable Chief Minister of Nagaland, Sri S. Pangyu Phom, the Honorable Minister of Health and Family Welfare, Government of Nagaland, Sri Amardeep Bhatia, the Principal Secretary to the Chief Minister and Development Commissioner, Sri Y.K. Seema, Commissioner and Secretary, Health and Family Welfare Department, Government of Nagaland, and Dr. Temjengt Sungla, Principal Director, Health and Family Welfare, and all the dignitaries on the stage, and all the audience here physically, as well as attending over YouTube and Zoom globally. I'd like to welcome you for this event. It is indeed a delight to be in this beautiful state of Nagaland. Reminds me of California, where I used to live many years ago. It's a lovely state. I've spent a couple of days here. I was given a very warm welcome by the government of Nagaland. When I landed at Dimapur, they draped me in a beautiful Naga shawl, which is wonderful. It was an honor to be draped with that. And today I thank the Chief Minister for draping me with another shawl from the Naga tribes. At the outset, I must say that it has been a delight to work with the government of Nagaland. The pace at which we have gone is incredible. The first time, we are working in 8 states. This is the first state where we have launched 10-bed ICUs in every district hospital within 1 year, in less than 1 year. please a round of applause to the government as well as the 10bedICU folks for having finished the project in less than 1 year. Not only have all the hospitals where these ICUs have been deployed, but the tele-ICU hub at the NHAK hospital that you would have seen earlier that the Chief Minister inaugurated was also launched in less than 1 year. So it's been wonderful. Well, I'll tell you a little bit about how this project started. I was actually working from home in my hometown of Mysore, in my mother's house, and I got a call one day. This was during the COVID Delta wave, which was sweeping the country. Oxygen was a problem. There were a lot of issues. And I got a call from a friend who said, Srikant, I need a ventilator for my mother who's old. She will die if she doesn't get a ventilator bed. This was from Bangalore. And I spent the next 2 hours trying to find a ventilator, and thankfully we did. Next day again a call. Now it was a 26-year-old boy who SpO2 level was 76. He was dying. Again, we found ventilators. This went on for almost a week to 10 days. Then I realized that this is unprecedented in the country. And at the same time, Dr. Sudarshan, who runs the Karuna Trust, who's a partner in this enterprise, he told me that it is not just in urban areas. It is not just Bangalore and Delhi and Mumbai and so on, but it's also in rural areas, and it is spreading fast. And unfortunately, in these smaller areas, in the smaller towns and villages, they don't have ICUs. So a lot of deaths are happening because of that. So while I was sitting there, I said, you know, we have to work on this. And though I didn't know much about healthcare, I've worked in healthcare in the United States at Healthcare on WebMD, whereas in India I have not. But so we started this project. So there are 5 pillars to this project. The first is the medical equipment. Basically, we create a 10-bed ICU in an existing government hospital, in an existing space, which the government provides after we sign an MOU with the state government. We take up all the districts, at least one hospital in every district. What we soon realized was, even after we launched 40 hospitals in Telangana, 36 in Andhra Pradesh, and so on, we realized that in spite of creating the ICUs, the medical staff, the specialists are not there in those smaller areas, in the rural areas. So that's a problem. And so hence we created the second pillar, which is the tele-ICU that you saw the CM launch today, where a medical hospital such as NHAK can provide its specialists to help those rural patients through an online connected cloud-based system. Okay, this is something we have built. It's a really nice system. I'll explain a little bit more about it. So we had to build a robust platform, which is pillar number 3, the care healthcare platform, a technology platform in order to make things scale elegantly and ensure that all the hospitals get the kind of EMR, electronic medical record, and the tele-ICU facilities and the pandemic management facilities. So we built that. I'll share more about that. Fourth, of course, is training modules. I'll talk about the kind of robust training modules we have launched. And lastly, the community participation so that everybody gets access to these assets. The community takes control and manages it with the help of the administration. So today, as you see, every district of Nagaland is covered. Well, I was informed while we were there that 4 new districts have been formed. We will endeavor to launch in those 4 districts as well. In fact, I'm requesting the HDFC Bank to fund those 4 districts as well. Because the request has come today, so make sure that we can do that as well. But as you can see, every district currently, as we know it, has been launched with 10-bed ICUs, including the far-flung districts, Mon, Noklak, Kifre, and so on. And we'll look at how they work out there. And we'll talk a little bit about the donors who have been extremely generous in making this happen as well. So the first pillar is basically equipment to set up a 10-bed ICU. This is the state-of-the-art equipment. This is not L1 equipment that we bought. The ventilators are imported from Switzerland because we needed AI ventilators so that in the remote areas, if you don't have a specialist, it will still, the AI ventilator can auto-wean the patient using the lung pressure and the CO2 levels. So we have brought in this, of course, we had to pay customs duty and so on, but still we ensure that it is top of the line. And in fact, we are hearing from your doctors as well as doctors everywhere else that this is an excellent piece of equipment. In fact, Dr. Rakesh, who is here from Imphal, was telling us yesterday, last night at dinner, that you just need 3 buttons to press before the ventilator starts. in many other places, it's very complex to, initiate these. 5-para monitors, X-ray machines, ECG machines, ABG auto analyzers from Siemens in Germany. All of these are state-of-the-art equipment. About 26 items are given to every hospital, right? We fund all of this. The capital costs are funded. Not just the equipment, the installation of the equipment at your locations, the training of your doctors and nurses at your locations, and a 3-year warranty. Usually you get a 1-year warranty. We have negotiated a 3-year warranty so that the government doesn't have to immediately start funding it. After 3 years, you need to fund the maintenance, the AMC contracts and so on. So as you can see today, from Noklak to Woka to Dimapur, Kohima, Tuensang, Fek, all of these hospitals are ready. These are photographs from those hospitals coming from about a week ago or so. Kifre, Mon, Dimapur, Mokchong, Zuneboto, and Longleng. All of them are ready. In fact, today, you're going to see a simultaneous launch. When the Chief Minister launches, you're going to see on the screen all the hospitals going live simultaneously in a few minutes. Second pillar, the tele-ICU. I talked a little bit about it. What we have done is we have connected the NHAK tele-ICU hub that the CM just launched to the various district hospitals that are there across the state. When we say connected, it is through an internet connectivity. 6 of them have high-speed fiber broadband internet. Other 6, we request the administration to also improve those in order to get the kind of video feeds and so on going, which I will talk about. So of course, we were just now at the Naga Hospital Authority Kohima, where we launched the tele-ICU hub. As you would have seen on the video, this is the tele-ICU hub room where the specialists can sit and help the patients in all your far-flung hospitals. It's one of the, Woka is one of the hospitals, a photograph of that. I just want to talk a little bit about, many of you are probably, from a clinical background, there's lots of nurses and doctors here. We provide 4 facilities. One is a doctor-to-doctor video communication between, the specialist and the local doctor in the district hospital, which is on the left. Below, we have also installed these high-res cameras in the far-flung hospitals, in your district hospitals, so that the specialist at NHAK can zoom in on the patient and take a look. You might have seen that in the demonstration we did live, right? These are powerful cameras, and you don't have to go figure out where is the patient. Automatically, when you put the patient name, the camera knows how to. Can someone there please stop talking? It's disturbing the audience. Yeah, thank you. So the cameras are high-res cameras that will zoom right into the patient. You can see right up to the pupil. On the right, you see the electronic medical record itself of the patient, including all details of consultations, treatments, and so on, as well as you can see the various views from the high-res camera. So the magic of this, a lot of people ask, how does this work? On the right side is one of the district hospitals. On the left side is the tele-ICU hub. And it's connected through a cloud software. And Google has been kind enough to offer their cloud services for free for a year to the state of Nagaland. So it's hosted on the Google Cloud right now. And whether it is the 5-para monitor, high-resolution camera, the video communication, or the electronic medical record, from the district hospital, it is conveyed to the tele-ICU hub. So the doctor feels as though he's in front of the patient. Every detail is there electronically, right? So we can go to the tele-ICU hub. We showed this to the Chief Minister. You can click on, let's say, Tuensang, and you see the patients there. And once you click one of the patients you want to consult with, you see the full details, the waveforms, the consultations, all of that. And you can use the high-res camera to zoom in on the patient, whether it's a bed view, the face view, or even the 5-para monitor view. These are all completely done through the software. The CARE platform manages all this. In fact, this is one of the network operation centers. We have built dashboards to manage the pandemic effectively. It has real-time analytics to monitor beds, ICUs, ventilators, oxygen monitoring, which was a huge problem last year. We have GIS monitoring for visualizations of capacity on a map of Nagaland, facility management, inventory control, and so on, and also the daily dashboards. In fact, one of the chief ministers asked us to put this dashboard in his own office because they wanted to track exactly how many consultations, how it is helping the citizens. And of course, all of this is free and open source. There is no proprietary software here. Even if the state of Nagaland wants to further build on top of this, we completely do that. And by the way, the United Nations has recognized CARE as the 50th digital public good in the world. So this was sort of a high honor coming from the United Nations on the software that is built by the 10bedICU team. The fourth pillar is the training. The medical equipment training is done by the vendors. They come here to your hospitals and train the doctors and nurses. The software, CARE software training is provided by the 10bedICU team. Aparna and her team do this. The tele-ICU module training. How do you communicate with a patient and a doctor 100 kilometers away? It's quite different from handling a patient who's right next to you in the bed. What is that protocol? How do you make that happen? So that is on the tele-ICU module training. The ICU clinical course, we have a basic course on ICU clinical. We also have an advanced course by the American Heart Association, and also training on ventilation and respiratory support, especially intubation and so on, which might be new to some of the nurses. So here are some photographs of the various trainings that have been happening. Already in Nagaland, we have started the various training. Now, a little bit about the donors who have contributed to Nagaland. Vinod Khosla, a bit about him, context of this. When we started running out of oxygen in Delhi, we were seeing this in the news all the time. He tweeted saying, I'm willing to help hospitals that have a problem in India. That tweet got retweeted 20,000 times. Okay, lot of people said, I will support this. Lots of company heads started putting money behind this. And in India, there's a lot of people who started asking him, I need help. We're running out of oxygen, we're running out of ventilator beds and so on. And of course, that sort of channeled into this project, the 10bedICU project, and we started taking up in various states. Today we are in 8 states. We are in 200 hospitals, 200 10bedICUs. And he has in fact donated money for 100 hospitals. He promised this when we launched in Telangana. And we actually reserved much of it for Northeast. And today, out of the 12 district hospitals, 11 of them are funded by Vinod Khosla, as well as the tele-ICU hub. A round of applause for our generous donor, Mr. Vinod Khosla. The HDFC Bank, I was earlier on the board of the HDFC Bank, and Shashi Jagdishan, the CEO, promised me that he is going to support the project fully. And today we have the HDFC Bank folks here. They have donated money for the 10bedICU in Dimapur, and I'm requesting them to help us in the 4 more districts that were brought up. So thank you very much, HDFC Bank. The 2 others, of course, the Google Cloud I mentioned, they have given us, the state of Nagaland, free access to Google Cloud, and the instance belongs to the state, not to the 10bedICU. The data and the records, all that belongs to the state, the health department, and Google has done that, as well as Hamilton Medical, the ventilator manufacturer. For every 2 ventilators we are buying, they're giving us 1 free, so I want to thank them as well. To wrap up, this is a coalition of partners. While the Delta wave swept and a lot of deaths were happening, we had to come together very quickly. So the eGovernments Foundation partnered with Karuna Trust, and we have the Secretary of Karuna Trust here, Venkat, and Dr. Sudarshan couldn't make it, but it's wonderful. And they are our local partner here as well. They have a good presence. And the Nagaland Gandhi Ashram has also helped us in implementing in, I think, 8 of the districts. Thank you so much. Of course, the funding has been for all the various states, Khosla Family Foundation and Parivartan, HDFC Parivartan, Give India, Crypto Relief Fund, and I myself as well. The medical technology partners we mentioned, Google, Hamilton, BPL is who has been providing all the equipment, as well as Dell. All the computer equipment comes from Dell. So all of them are state-of-the-art, high-quality equipment from the best of breed. The project management unit, I just want to take a minute. Sri Abhijit Sinha, the Home Commissioner, Sri Y.K. Seema, the Commissioner of Health and Secretary, Health and Family Welfare, Srimati Ansangla Imti, the Secretary of Health and Family Welfare, Dr. Temjeng Sungla, the Principal Director of Health and Family Welfare, Dr. Ritu Toor, Mission Director, Dr. Chumbabati Chang, the Joint Secretary. They've all helped us to make this project happen. And of course, our own team has also been part of the PMU that has made this happen in less than 1 year. The 10-bed ICU team itself is a fantastic team. It's quite a small team, very professional. Mr. Vinod Khosla has been a huge donor as well as a mentor for the project, and you have Dr. Sudarshan from Karuna Trust. You see all of them here at different levels who have worked really hard from around, Kerala, in Karnataka, in Northeast. And I want to single out one person, Bisoya Leutenbaum, who's here on stage today. She is from the Northeast. She is the Northeast coordinator of the project, and her team is all being camped here in Nagaland, working day and night on the project. And I want to say today, the fantastic work she's done in Northeast, she is now promoted as the coordinator for all of the country for 10-bed ICU projects. A round of applause for Bisoya. So I'd like, sir, if we'd like to show you a video that we created on this project. Can we play the video, please?
The 10-bed ICU project will provide the much needed critical care services to all the district hospitals in the state.
Noklak Pride 4 blocks cover grace are 40 villages ase Arokwan is more than 150 villages to beyond the border ase. So Noklak district idu hospital, this is the only district hospital idu hospital to hile so manu idu ki depend kore ase.
So condition bishi biase to emergency thaga time de jaldi ola bole aro pia hoi jai aro any serious thagina aha time de sometimes it's difficult for the patient travel in such kind of road to face kore ase dia.
The topography and remoteness of Nagaland has always been a challenge to make critical care accessible to the remotest parts of the state. The 10-bed ICU project is a public-private partnership between the Department of Health and Family Welfare, Government of Nagaland, and the 10-bed ICU partner NGOs led by eGovernment's Foundation. Conceived by Mr. Shrikant Nadamuni, the founding CTO of Aadhar, the project aims to create a 10-bed ICU unit networked with a tele-ICU hub using a robust technology platform in a government hospital in every district of India by 2025. A high-level project management unit is formed to oversee the overall implementation of the project.
In order to strengthen that state project management unit in the higher level, recently the department has constituted a subcommittee with departmental experts from the Directorate of Health and Family Welfare.
The project tries to address three critical problems: missing ICU beds and specialists, disparity in critical care infrastructure, and inadequate digital infrastructure.
Rasta debi oxygen lo jalobi takhan to facility yate man na ito pa rasta de patient muni jaina.
We are at the age of super specialty, but which is lacking in our hospitals. We wish to have specialties in all the fields.
The bishi pak the farmers khane ase the finance wale bishi diktar ho jai to hospital de bishi forward na hai tahan bi duk pai jai to ane bishi serious no attack to na hai patient han do ina kona bishi serious na issue le to han do mohan sawona pari je issue le to bishi pak to repair le olai jai.
Through this project, we will have the ICU facilities at the district hospitals in the state of Nagaland.
The 10-bed ICU project has 5 pillars. To overcome the lack of ICU facilities in rural areas, the project provides a set of ICU equipment required for running a 10-bed ICU units in the district hospitals.
Equipments that are provided are of the best quality, and I believe that they will go a long way in providing the necessary services to the patients out there.
10 numbers of cardiac monitors, 10 numbers of infusion pump, and portable X-ray. Ito ang nilid kung chule la to mohan karne sapna de bhi na thakan nisna ita de chule. Itia reality de sahi chule.
These equipments will make my work easier, and then it will help me in giving better care to the patient.
To overcome the lack of human resources for running the ICU, the project has set up a robust tele-ICU hub and spokes IT architecture, connecting specialist doctors of the Naga Hospital in Kohima as hub and the doctors of the district hospitals as spokes.
I'm just a medical officer, and then guidance ekta na thakile to maybe major the function of so daily ICU thakata ekta major advantage ekta ase more health professionals kan karne.
Congratulations to your team as well. Thank you, sir.
It is a matter of minutes only where we can consult a super specialist regarding our patient here.
Now with daily ICU, with the monitors, we don't have to be there in the patient's bed at all the time. We can look at the monitor in the nursing stations, and then from there we're able to monitor the patient's conditions.
This tele-ICU hub will give an extra set of eyes to the doctors and to the nurses working. So it will help us to monitor our patients in a wholesome manner, and also with the help of the cardiac monitors and the online real-time monitoring of the patients, we'll be able to help the other far-flung areas of the districts where we cannot reach them due to the poor road connectivity.
The CARE platform that hosts the tele-ICU is a robust technology platform recognized by the United Nations as a 50th digital public good. It has several modules such as patient management, clinical management, provider management, asset management, facility management, and inventory management.
CARE will be ABDM integrated. The first milestone is to enable creation of ABA number through CARE and allow patients to be enrolled under ABDM to generate health ID. The second and third milestone is to allow CARE to share clinical data with other ABDM compliance systems with the consent of the patient.
If we can monitor through a regular dashboard on utilization, patient's admission, clinical data, and inventory, we will be able to assess the gaps and act.
Human resources with critical care expertise is important. Certification training of doctors and nurses on basic and advanced critical care will be provided. Training on use of medical equipment are being carried out. Technology training will be a continuous process. Training method will evolve and be co-created in consultation with hub doctors and the Directorate of Medical Education.
Since the time we received the equipment, we have already started training our staff with the basic module, and definitely we want to also help our other colleagues in the other districts if they have not started using the equipments.
Kita training bo makanje inform perdigi, aro makanje itu staff kan tu training lobanya mangse itu sebab punya training lobo.
Itu ICU to install kori na para jashe kule do makanje patient ahile do bishi sera chui na hakanje bi thik time de quality care do diwa paribo.
To ensure better governance of the facility and its long-term sustainability, the project will provide training and capacity building of the Rogi Kalyan Samiti to perform the committee's role of governance and hospital management.
Nagaland has a very strong community ethos and a long history of communitization. If the project can work with the RKS members or village health committee members, they can be trained them properly on the basis of how to conduct meetings, manage the healthcare delivery system, improve services, and in terms of fund utilization.
I would like to appeal everyone to take it as an ownership and use it for the benefit of our people, that it can able to achieve in the principle of 4C, that is coordination, cooperation, confidence, and contribution by the people.
heartfelt thanks to Mr. Kosala and Mr. Serikan Natamoni for his generous support to set up ICU ward in 11 districts and Delhi ICU across 12 districts in my state. You will get blessings from the thousands of families in Nagaland. Please continue doing great work. We need people like you to work towards the development of Nagaland collectively.
Thank you. Thank you. As you can see, every level of the state government, especially the health department, the administration, the doctors, the nurses, the staff, all of them have been part of the project, and it's been a delight to work with all of them. The next part of the program is very exciting. Can we bring on display all the hospitals, all the 12 hospitals? They're getting ready to launch. So can we first bring them up on stage? Wonderful. Mr. Khosla is also here for the next item. Sir, can I, Honorable Chief Minister, can I request you to launch the 10-bed ICUs in all the 12 hospitals across the state? Wonderful. Thank you. So can you, okay. So the next item we have is actually an interaction. I think Mr. Vinod Khosla is already there and he's joining us. So can we have Vinod online, please, for his address?
Thank you, Shri Srikant, for the awesome presentation. You have brought ICU services at the doorstep of our homes. We will now be virtually joined by Shri Vinod Khosla, named by the Fortune magazine as the most successful venture capitalist of all time, founder and partner at Khosla Ventures based in Silicon Valley, having funded many successful tech startups, funded a lot of COVID work in India. We in Nagaland are recipients of his generosity in funding 10-bed ICUs in 11 of the 12 districts. Please welcome Vinod Khosla. He will deliver a speech from California, followed by a short interaction with our Honorable Chief Minister. Sir, please.
Thank you. Can you hear me okay?
Yes, we can hear you.
Okay, thank you. Well, I'm delighted to join the launch of the 10-bed ICU project in Nagaland. I do want to start by congratulating the Chief Minister of Nagaland, Mr. Nefirio, and the 10-bed ICU team, and of course, Srikant and his team on this occasion. I'm told this was set up across 12 hospitals, every district of Nagaland, with a tele-ICU hub at NHK Medical Center in less than a year. That is pretty fantastic. So I'm very, very excited to see what progress has been made. I know Nagaland is a largely mountainous state and a remote state, and I'm really, really glad to see you embraced 10-bed ICU care health platform and engaged your specialists at the NHK Medical Center to deliver medical care to your remote district hospitals. I do believe that this telehealth system is just the beginning of much more extensive care. It's a precursor to much better and cheaper healthcare through AI services also delivered remotely. So it's just the beginning, and hopefully, if you're interested, we can talk about what can come next beyond this that would be even more significant. I know the only way to deliver quality healthcare for remote rural populations is by the innovative use of technology and standardized clinical protocols. Given the limited number of ICU specialist doctors that can take care of a large number of patients, I'm very, very happy to have funded the 10-bed ICU wards at 11 districts and the tele-ICU hub, and look forward to hearing about the much improved critical care outcomes across the entire state. Once again, I want to thank the Chief Minister Rio and the Department of Health and the 10-bed ICU team for having implemented this very ambitious project. I do hope that we will not stop there. My dream would be not only the 12 district ICU units, but I do believe small kiosks and small portable vans can make primary care offices available in 1,000 districts at very affordable cost, and then have AI complement the expertise of the limited specialists you have. So I do hope within 5 years we have a very, very different and maybe a world-defining model of how healthcare should be provided everywhere. I look forward to that and working with the team there to maybe implement that kind of vision. Thank you very much.
Thank you. Thank you very much. Second.
You can skip questions. Do you want it?
On behalf of the state of Nagaland, I want to thank you very much for coming on virtual. We can hear you and we see you, and we're extremely happy that you are participating in this inauguration of 10-bed ICU. The sponsors and the organizers who are with here are extremely excited, and your commitment to serve the needy people. We are in India, frontier state, bordering Myanmar, which is going through a very difficult time, and these are hilly state and have a bad terrains, connectivity is a problem. So e-medicines and through these consultations, the specialists can extend. And your commitment for the needy people, and also this will not be the end, and it will go for further expansion. That is a good news to us. And on behalf of the state of Nagaland, if time permits, if you can visit our state, it's a lovely state and people are very friendly. So we would like to have you when we have the biggest festival, in other times also, but the biggest festival, which is called Hornbill Festival, it goes for 10 days. And all the tribals of the state, we have 17 tribes, and all come together, including the whole Northeast and the friendly neighboring states also. So if you can come, we will welcome you and will be extremely grateful. I had just launched the 10-bed ICU, and also I had gone to the NHAK and the tele-hub where they are monitoring. It is extremely exciting. We can see the patients all over the district hospitals in the ICU, and also can zoom. And I think the Nagas, we have very much attachment in the family. So when one is sick, either in ICU or in the hospital, everybody go to visit, which is not a wise thing, because the disease also can be contacted. But we can talk to the patients, seeing them ourselves, and the patient seeing us. So that is a big relief, and this will be very popular, and I hope my state will make the best use of it. And we need your support and cooperation. So thank you very much for what you have done. A big thank you and all the best. Thank you.
Honorable Chief Minister, and thank you, Sir Vinod Khosla, for your awesome donation to the state of Nagaland.
The Cabinet Minister in charge of Aadhaar and On India Stack, he helped to launch UPI, DigiLocker, ONDC and other important nationwide digital public goods. Currently the chairman of Infosys, but actively engaged in philanthropy, Shri Nandan Nilekani and Rohini Nilekani have taken the giving pledge to give away half their wealth towards philanthropic causes. Ladies and gentlemen, please welcome Shri Nandan Nilekani, who will now present a speech via live streaming.
I am really delighted to be part of the launch of the 10-bed ICU project in Nagaland. I want to congratulate the Chief Minister, Mr. Neviu Rao, as well as the project team of E-Government's Foundation for this wonderful event. COVID has demonstrated many of the inadequacies of our medical infrastructure. Nagaland especially, because of its hilly terrain and remoteness, faces even more challenges to deliver healthcare to everyone. With the 10-bed ICU and the online tele-ICU capability, it is possible to take the expertise of specialists to every nook and corner of Nagaland by having a 10-bed ICU in every district. This project is part of a long series of projects in India of creating what we call as digital public goods. Public goods for the society and the people using digital technology. And there are many, many examples of that, beginning with Aadhaar, then DBT, UPI, account aggregator, and many more to come. 10-bed ICU project is part of the reforms happening in the health sector, along with things like the Ayushman Bharat Digital Mission, which is run by the National Health Authority, whose CEO is my colleague, former colleague and close friend, Mr. Ram Sevak Sharma. And I'm glad that 10-bed ICU is getting integrated with ABDM. I believe that technology used properly for the benefit of people is the only way that we can drive equitable society, an inclusive society where everyone has access to education, health, jobs, and career advancement. So once again, I'm delighted to be speaking at the launch of the 10-bed ICU project in Nagaland, and I wish the Nagaland Chief Minister, Mr. Neviu Rao, as well as the Department of Health and Family Welfare, all the very best as they take on this momentous launch. Thank you and have a great day.
Thank you, Shri Nandan, for the inspiring speech. May I now request our Honorable Minister of Health and Family Welfare, Shri Pangyupom, to address the function.
Most respected special guests of this auspicious event, Sri the Honorable Chief Minister of Nagaland, respected
Reverend Wizoba Gaho, Chairman Enforce Sri Nandan Nilkani, respected founder Khosla Ventures Sri Vinod Khosla, Chairman 10bedICU Organization Sri Srikan Natamoni, respected Commissioner and Secretary Health and Family Welfare Sri Y. Kekedo Sumi IS, Program Coordinator and Policy-led E-Government Foundation Ms. Bisuyo, my dear doctors, nurses, healthcare workers, friends from media, ladies and gentlemen, I am honored to be here with all of you today, participating in the launch of 10-bed ICUs and 12 districts of Nagaland and the Delhi ICU hub at the NHAK. This is a momentous occasion as it marks an important step. With the help of the 10-bed ICU project, we are enhancing the critical care infrastructure across Nagaland, especially in the light of the recent spike in cases in several Asian countries. Our focus on improving our ICU preparedness to protect our vulnerable population comes at a timely juncture. I had the opportunity to visit the Noklak District Hospital yesterday, and I was very impressed by the brand new 10-bed ICU ward at Noklak that has been created there. In addition, the state-of-the-art ICU medical equipment and cutting-edge Delhi ICU technology will bring transformational change in healthcare delivery across Nagaland by delivering the much-needed ICU critical care to our people, even in the remote and mountainous districts of the state. I want to assure all of our district hospitals that we will provide high-speed internet connectivity to ensure that the Delhi ICU services enhance access to specialized at NHAK are available. We will also ensure that specialized doctors at the NHAK will be assigned to help patients in the district hospitals in the state. However, it is important to note that these 10-bed ICUs are not just a timely measure against COVID-19, but rather a long-term investment in our state's overall critical care health care delivery. This project is a win-win for all because with the new ICU infrastructure and technology from the 10-bed ICU project, needy people can get their treatment within their district
instead of traveling elsewhere seeking medical care. Further, the treatment will be provided free of cost by the hospitals through the Chief Minister Health Insurance Scheme. The hospitals, in turn, will generate revenues from the CMHIS as hospitals for providing free treatment. The hospitals can invest the revenue thus generated from upgrading infrastructure for delivery of quality care and expansion of services, and the positive cycle will go on. I urge all public hospitals to capitalize and amplify their resources through this noble venture. I would like to take this opportunity to thank Mrs. Serikan Natamoni for his leadership in creating 10-bed ICUs all across Nagaland, and to thank Mr. Vinod Khosla for his generous funding of 11 district hospitals out of 12-bed ICUs in the state, and the Delhi ICU hub at the NHAK. I would also like to thank NHFC Bank for supporting the 10-bed ICU at Timabur. I would like to request E-Government Foundation and the state donors to support in setting up more ICU facilities in the recently carved out districts of Chumukidima, Newland, Samador, and Jaminu, and also in the strategic sub-districts hospitals, as well as set up another hub at CIHSR, Timabur, as we would need more specialized to support all the 16 districts. As we have witnessed the potentials of Delhi ICU this morning, leveraging technology is key to solve many problems of delivery of healthcare services, owing the acute shortage of skilled manpower, limited financial resources, inherent problem of difficult terrains, etc. I request the E-Government Foundation to reconsider to support the state in setting up Delhi radiology facilities in Nagaland. Thank you once again, 10-bed ICU, for your support and collaboration in this important initiative. Kognalem and Jai Hind.
Thank you, sir.
Once again, I would like to welcome our Honorable Chief Minister of Nagaland, Sri Nipuryo, to address the program.
Respected Chief Host, my colleague Sri S. Pangnupom, the Medical Minister, and respected Reverend Vizapa Rakho, who is the President of KOHIMA Baptist Pastors Fellowship, respected Chairman Infosys, Sri Nadam Nilakani, and Founder Khosla Ventures, Sri Vinod Khosla, Chairman 10-bedded ICU organization, Sri Srikant Nadamuni, Commissioner Secretary, Health and Family Welfare, Sri Y. Kiketo, officers and staff of Medical Department, Program Coordinator and Policy Lead, eGov Foundation, Ma'am Bisoya, my dear doctors, nurses, and health workers, friends from the media, ladies and gentlemen. Indeed, it is a great pleasure for me to be here today to launch the 10-bedded ICU project in our state. At the outset, I would like to welcome our guest of honor, Sri Nandan Linikani and Sri Vinod Khosla, who had joined us in video conferencing from Bangalore and California, and Sri Srikant for being physically present here in this launching program. I'm happy that the hard work done in a very collaborative manner by the 10-bedded project partners and the Health and Family Welfare Department, which is bearing fruits today, and we are ready with ICU facilities, with teleconnectivity in 12 district hospitals as of today. This morning before the program, I went to the Naga Hospital Authority KOHIMA and launched the e-hub, and with the demonstrations which I had seen is very impressive, and I hope we will make a good use of it. As requested by the Minister, Mr. Pangyu, I hope it will extend to the 4 new districts and also in the referral hospital in Dimapur. I'm happy that the hard work done in collaboration manner are successful, and in due course of time, I feel we'll get more benefits. We had heard about the innovative and focused measures which eminent sponsors of the project wanted to establish 10-bedded ICU facilities in some districts in the country at a time when we are all grappling with the deadly second wave COVID-19. Trusting that it would help us meet the challenges for providing such facilities in our state, we approached the e-government foundation through Mr. Nachiket Moore in May 2021. Subsequently, an MOU was signed with e-government foundation, Nirman organizations and Karuna Trust. We are grateful for your coming towards to partner with the state. The state government, as also in many other similar located places across the country, had found it very difficult to make ICU facilities operational at district level other than at our Naga Hospital Authority, KOHIMA. There are various reasons for this. Foremost among this being insufficient specialist doctors and the infrastructural deficiencies. I'm happy that this project has, in a very systematic manner, first carried out a survey of existing facilities and assessed the infrastructural requirements. Therefore, it has provided quality equipment, multiple channel monitors, ventilators, infusion pumps, ICU beds, and also addressed the need for civil works, etc. I had personally seen some equipments for blood tests and portable needs of the critical cares. The most critical part of running an ICU is the manpower. I'm very happy that the project has innovatively addressed the difficulties on account of the shortage in specialized doctors through the tele-ICU hub at Naga Hospital Authority KOHIMA, and also by linking with resources outside Nagaland. The available specialist doctors in NHAK will now be able to monitor and provide critical care services remotely over high-speed internet connections and using cameras, which I was having discussion with the COSLA. Without this physical presence of specialist doctors, and instead of going through their remote guidance, the trained healthcare staff at a district hospital will be able to provide ICU services. The project has a potential to transform the provision of critical healthcare services in government hospital in the state. It will provide such services within a shorter travel time for the needy patients, even the remote districts. I'm sure that the medical doctors and nurses of Health and Family Welfare Department will use this opportunity and optimally use facilities created for providing better facilities to the people of the state. Any projects of such kind will evolve over time, and I'm sure that all the parties, the e-government foundation and other sponsors and the department will nurture it to maturity and success. My government has been committed to facilitating our people to achieve their full potential by providing improvement education, healthcare, and core infrastructures. In addition to providing improved healthcare services closer to our citizens, we are also providing financial cover to the entire population of the state with a unique Chief Minister's health insurance schemes, along with the Honorable Prime Minister Ayushman Bharat Jan Arogya scheme. And I hope you are getting yourself registering to get the health card. You are aware government is providing 30%, government is providing all the insurance, and the government servant will get 20 lakhs in 1 year for the family, and you can walk into any hospital to take treatment. You have only to sign the bill that they had charged. And then for the citizen as a whole, anybody besides the government servants and the elected will get a benefit of 5 lakhs for the family in a year, and so it will be a cashless transactions, and I hope you will take this advantage. And as I was discussing with Srikant, any patient, before you could have a health card, you can walk in and the hospital will help you to fill up the form, and with no time, your health card will be made for you. I would like to take this opportunity to thank Mr. Nandan Linekani and Mr. Srikant for their constant support, and Mr. Vinod Khosla for the support and generous funding of the 10-bed ICU project and the tele-ICU hub in the state, and for being part of the functions today. Taking advantage of your presence, I would like to request your personally to expand your engagement not only in the health sector, but also in using technology to meet the challenges of development and attracting investment in remoter parts of mountainous areas like Nagaland state, and also promoting entrepreneurs ecosystem in the state. I can assure you that you will find engagement with the people, especially the talented youth for the state. I hope you'll find very rewarding. So, on behalf of the state of Nagaland and the citizens of the state, a big thank you to our donors and partners, and I congratulate the citizens of the state for these critical healthcare units which are built with our partners all over the state. It is my prayer that this collaboration between us will be a first of many more in the days to come. Jai Hind and God bless.
Sir, for your inspiring speech.
I now invite Ms. Bisoya Loitongbam, who is the Policy Lead and Program Coordinator of E-Government Foundation, to kindly deliver the vote of thanks.
Honorable Chief Minister, sir. Okay. Yeah. Honorable Chief Minister, sir. Honorable Health Minister, sir. Respected dignitaries and dear friends, I have to thank so many of you who have made this dream launch event possible. But before I do that, I take the liberty to explain what the launch of 10bedICU in Nagaland really means to all of us, and why we are so thankful and hopeful for this event. This event is a symbol of our collective belief that something as precious as access to critical care must be viewed as a right. Our belief in equal opportunity for critical care has a strong foundation and is rooted in the idea of justice. Professor Amartya Sen, the Nobel Prize-winning economist and a global expert on justice, has argued for making health equity central to the idea of social justice. Health equity means that everyone gets a shot at fair innings irrespective of whether they are in Noklak or Kohima, or whether they are in Dimapur or in Delhi. Our project questioned why it should be all right for people in remote districts or those who are poor or suffer from other forms of exclusion to have less than fair chances of recovery from COVID and other life-threatening diseases. Although this is just the beginning, we will continue to build on this promising start and make this project a truly transformational project for the state. Given the level of enthusiasm and overwhelming support we have received for the project from the state government, we are emboldened to dream that this project will go beyond being an island of excellence and trigger similar collaboration in other sectors and domain will be a start of something truly transformational for Nagaland. This launch has been truly a dream launch for all of us, and I have a long list of people to say thank you. First and foremost, I must thank the Honorable Chief Minister for believing in the project and for his gracious and limitless support for the initiative. Thank you, Honorable Health Minister, for believing in the project and setting the agenda and vision of the project. I want to thank Mr. Amardeep Bhatia, sir, the Principal Secretary, who is not here today though, for his support from the very start of the project till today. Thank you, Manicol John, sir, advisor to the Honorable Chief Minister, the invisible hand who played the role of a catalyst. Thank you so much, sir. Earlier, we planned to do a phase-wise rollout, but the Honorable Chief Minister expressed in December that we all should launch at one go all the 12 hospital tele-ICU. Without your support, it is unimaginable how we could have completed the tele-ICU setup for 6 locations in just a month. Special thanks to YK Sema, sir, the Health Secretary, for his energizing and inspiring presence in the field, for tracking continuously each and every activity and continuously motivating our team. Thanks Asangla Imti ma'am for all the prompt order, frequent meetings and support. Thanks Joint Secretary Chubawati sir, Rena Bumo sir. Special thanks to all the committee members who ensure speedy approvals, whether it be internet connection, power supply or civil work. I would like to thank Dr. Kika, Joint Director. It has been an absolute honor working with you. Thanks for taking the ownership and championing the implementation. We were really inspired by your work ethics, passion and integrity. Thanks to all the track members for helping us with the launch event, Dr. John, Dr. Tinu, Dr. Asangla, Dr. Temsu and many others. I would also like to thank Ajit Ranjan, sir, DC Wakha, who had helped us during the initial tie-up stage. Thanks my friend Roland Lotha from the Rural Development Department, who helped me in establishing Connect during the MOU partnership. The success of the project lies with the ownership of the hub and spoke doctors. We're extremely fortunate and grateful to MS Dr. Sandimiran sir, Dr. Akhre for the ownership and drive. Without their support, the tele-ICU hub and spoke setup wouldn't have been possible within a month. I also want to thank all the MS, medical superintendent, doctors and nurses in the district hospital for inspiring my team, for motivating my team. Thanks the donor, obviously, Mr. Khosla, thank you so much. Thanks HDFC Bank CSR team, who have been more than a donor, they have been like a team. Nusrat, Ritesh, Neeraj. Thanks Hamilton Medical for donating for every 2 ventilators we procured, they donated 1. Thanks Google Cloud for providing us the cloud credit. I also want to thank our vendors, Rajesh Sethi for land cabling, the team from BPL, our equipment vendor, Mukta Gohan and team from Hamilton Medical for ensuring the equipment were delivered, installed, tele-ICU, land cabling and installation were done, irrespective whether it was a Sunday or Christmas or New Year holiday, everybody really worked hard. I want to thank the Unibro studio team members, Shane Jackson and Kevin, for the beautiful CM launch video and all the amazing interview coverage you guys have done. Thanks to our field NGO partners, Venkat Garu, Karuna Trust, Dr. Avatosi of Nagaland Gandhi Ashram for supporting us with the field implementation and deployment. Thank you, Tialong from Gandhi Ashram for quietly and swiftly delivering results whenever needed. And obviously, thank you very much, the 10-bed ICU team, for all your efforts. Sei and James for becoming Superman, traveling across all the district hospitals to give user training. Atsi for being the enterprising and reliable state program manager in Nagaland, seamlessly coordinating with all stakeholders. Kajal and Chandraban for always surprising us and getting things that seem seemingly impossible. Whether the completion of ICU installation, tele-ICU, Moita for all the crucial support for documentation, video making, Ashrumita for taking care of our guests and other support, Dipankar and Dibjyoti for playing this good supporting role. I would also want to thank Sujata, who has ensured all approvals and payments are done and smoothing the back-end operation, Perumalji for his support, Bala for helping us with the online event, Amruta, Gigi, Matthew, Aparna, thank you all so very much. And obviously Srikant sir for being the person it's so great to know him as a person, but a great leader and a great manager and an amazing human being. Thank you so much. Thank you very much. Yeah.
Thank you, ma'am. A certificate of appreciation will now be handed over by Ms. Bisoya to HDFC Bank Privatization. Ma'am, you may do the honors. Thank you.
Thank you, ladies and gentlemen. We have come to the end of the second event. Refreshment is prepared for the VIPs at the cafeteria. For the rest of us, as we go out of the hall, you may kindly grab a pack of the refreshment.